All right, well, most of us have now accepted the fact that some form of face covering is going to be around for the foreseeable future. But have you started to notice that your breath doesn't always smell so great behind your mask? Maybe you've been subjecting other people to this all along. Joining us this afternoon is dentist Melissa Santilli to talk more about this. Melissa, this is probably a harsh reality for a lot of people who didn't even know.
Yes. So this is something that people are noticing more and more because when they wear a mask, they're kind of trapped behind that mask and they're breathing out they're breathing out their mouth and then breathing it in immediately. And so they're noticing that, hey, it's important for me to actually get my professional cleaning and get back to the dentist to make sure that I do get this bacterial load under control. Because not having access to dental care for a few months, especially with people with gum disease, is becoming a more serious problem because we don't want them to have irreversible bone loss or damage into their gums because they can't get back to the dentist.
Yeah, let's talk a little bit about that because I think that, you know, some people have been putting off those appointments. Maybe they haven't felt comfortable about being back in the chair again with someone right next to them. The longer you wait, the more likely you are to have more of that stuff that really has to be scraped off when you're sitting there in the dental chair.
Yes, because bacteria, it's a natural progression for that bacteria to keep accumulating in your mouth. And modern dentistry, we have professional dentists that can take care of that for you. And so we've noticed that, you know, especially first responders who have been sacrificing on the front line, taking care of people, they're noticing a lot more plaque underneath their gums. And so I'm the owner of Honey Dental, and we are doing something special just for them. We are doing their deep cleanings at no cost for them because I feel like they're out there helping us and taking care of us, and we need to be taking care of them. But if we don't take care of it, that plaque buildup underneath the gum will cause more and more bone loss, and we don't want them to experience anything like that during this pandemic.
Melissa, let's say that somebody is sitting at home and they're feeling a little bit leery still. They've been putting off that appointment. What reassurance would you give people right now about heading back in and being close to somebody and having this work done?
So it's important to think of your mouth as the window to your health. And if you allow that bacteria to accumulate, it can influence the rest of your body. For example, you know, related to heart disease and other issues. But in the dental office, all the doctors are wearing special protective gear, and it's very safe, and they sterilize after every patient. And so it's actually probably safer to go there than like your local Walmart, just because everything's wiped down, sterilized, and I feel like they should feel confident going back to the dental office to get that professional cleaning. I
think a lot of people are probably noticing this after they have had something to drink during the day, maybe after they've had something to eat during the day, because so many of the things we eat or drink have sugars in them, whether we know it or not, and then those sugars get to work in the mouth and you're feeding that bacteria. When do you know that your breath, though, is a sign that there's something more serious going on?
So if you're feeling any kind of sensitivity with hot, cold, or if you're feeling like, you know, you can't even stand your own breath, that's an indication that the bacterial load is so intense that you really do need professional help. And you don't want to wait until it creates any kind of serious problems like an abscess or anything else, like extreme pain, before you head to the dental professionals. So I think it's really important for you to pay attention to the fact that this is a strong reminder, wearing the mask, that you do have to take care of your oral health for your overall health as well.
All right, dentist Melissa Santilli giving us some timely advice about taking care of the old mouth this afternoon. Thank you very much, Dr. Santilli. Really appreciate it.